Christy, one of the toughest things after surgery is stair climbing, and so this is really important to get down prior to surgery. Christy's going to go over the mechanics of going up and going down stairs. And again, this is something that you will be able to do either the same day or the day after surgery.
Yes, we have a lot of patients ask, am I allowed to do stairs? Will I be able to do stairs after surgery? And there's no reason why you can't, especially if you were doing them prior to surgery. You should be able to do them after surgery. Just the difference is you're going to be going up and down very slowly and one step at a time. If you have a lot of stairs, you recommend having a person with you until you're able to move around without holding on to anything, okay? Now, we don't use a walker on the stairs, okay? The walker has wheels on it, so we're not going to be using a walker on something that you're going to have to be moving around. So we usually put a cane in one hand. If you have a railing, we encourage you to use the railing. If you don't have a railing, we usually put a person on the other side of you, unless you don't need it that much help, okay? So if I have a left-sided rail and nothing on this side, then I'm going to hold on to my left-sided rail and put my cane in the other hand. When you're going up and down the stairs, it doesn't matter what side the cane is on. We just want to make sure you have something in both hands, whether it be a rail or a person in one and a cane in the other, okay? So this is my strong side, okay? So my cane is being held on the opposite side of surgery, okay? My left one is my surgical side. So you're going to hold on to your rail. You're going to have your cane in your other hand, and you are going to be going up and down the stairs one step at a time, leading up the stairs with your strong foot first, okay? So your cane's going to stay on the ground with your operated foot. Good foot up first, and then you're going to weight shift, push on your cane, pull on your rail, and bring your cane up with your operated foot, okay? So we're going to do that again. Readjust your hand position, strong foot up first, and then you're going to follow with the cane and your operated side, okay? For most people, that's pretty intuitive. Now coming down the stairs, it's completely different. If you only have a railing on one side and you don't have the option to switch to the other, you're going to have to move the cane into the other hand so you can hold on to the railing. If you don't have any rails, then it won't matter. You should still have a person in the cane, okay? As you're going down the stairs, it's complete opposite than going up. So watch very closely. You're going to put your cane down first and then your operated side, okay? Weight shift and then bring your good foot down, okay? One step at a time. Cane down first, operated side down first, then your good foot, okay? Once you get down, if you're holding the cane on the opposite side of surgery, switch your cane and you can keep going. Okay?
Yeah, Christy, let's go over the mechanics of that one more time, going up and then going down. Patients will often tell me, I have 58 steps. They counted the number of steps they have in their home, so this is something that's on their mind. What are the common mistakes patients make going up the steps?
Going up the steps, most of the time, they just try to just go up like this. And for some people, they can. It's just we want to make sure you're being safe in the beginning, so that's why we break you down and only have you do one step at a time until we feel that you're safe enough to do it reciprocally. So that's usually the biggest thing. You kind of know if you're trying to go up the stairs with the other leg, you kind of see the patient go like this to try to get it up. And I say, well, does that feel comfortable? And they say, no. Bring your other foot down. Try with the good foot. And they say, oh. That makes so much sense.
So you're going up with the non-operative leg, and you're really using your arms to both pull up the railing and push off the cane.
Mm-hmm.
Yeah, and then you're just swinging the other leg up.
Mm-hmm.
Okay. Tell me what are the main mistakes that people make coming down the stairs?
Coming down the stairs, they always try. I'm not sure why, but they always try to bring their good foot down first, and that's when you really have a high risk of falling, because if you don't have the strength in your operated side, whether it's here or here, that's when you can buckle and fall down the stairs. So really making sure that you're putting your cane down and then your operated side, your good one is going to be the one that's doing the lowering for you. You're just gently placing your operated foot on the stair below. Once you have your weight shift in your hands and your cane, then you'll bring your good foot down. So it's the mechanics of making sure your knee's not going to buckle as you're going down the stairs.
Right, and then that leg just helps you control your weight as you're coming down.
Right.
Okay. And this is something that patients should definitely take the time to practice before surgery, going up and going down.
Yes.
And just have them pick up a cane somewhere at a drugstore and practice this, or they can practice with their caregiver.
Right. Or if you have rails on both sides that you can actually span, that's even better, because then you can hold on to both. But for most people, it's very rare to have that set up.
Yeah, I think the other thing is if you practice this stuff ahead of time, and then when you come and meet Christy at the preoperative class, then she can just fine-tune you and coach your form, rather than having to learn this just from the beginning.
Mhm.
Okay. Well, Christy, thank you so much.
Mhm.
We'll see you at St. John's.